Hey everyone, welcome to video 7 in the myth busting about lasers video series. This video I'm going to go in a little bit of a different direction. So far we've focused quite heavily around the devices themselves and all the different components that make that up. I just want to start exploring photobiomodulation itself and what's happening on a cellular level. So when we think of lasers, we're talking about the actual physical device that we're using to deliver that energy. The name of what's actually happening on that cellular level is photobiomodulation, or PBM therapy. And this is a newer term, it's still a few years old now, but in terms of historically, we would use all sorts of different names. So, you know, hot laser, cold laser, low level laser, high powered laser. And it got a little bit confusing about what it was actually related to. And, you know, from a cellular level, that was very much more the devices rather than, you know, what was actually happening under the skin surface. So PBM therapy is, you know, what we're going to explore. And, you know, if you're looking for any research around the actual, again, technicalities of what's happening under that skin surface, then PBM is what you want to search. So when we have our laser device that's emitting light, those little packets of photons, they're traveling obviously towards our target tissue. When that light gets absorbed, those photons get absorbed. If you go back to your school days, breaking down the cell, we have the mitochondria, which is the kind of powerhouse of the cell in terms of what's happening around. Now, on the inner membrane of that mitochondria, we have cytochrome C oxidase, and that's a key photoreceptor. So that cytochrome C oxidase likes light, and it's going to absorb those little packets of photons. And because of this, we're going to kickstart a chain reaction of various different things, and we'll probably explore these in a bit more detail in future videos. But ultimately, we get an increase in ATP, reactive oxygen, and nitric oxide. Those are the three main chemicals that we talk a lot about. So with our ATP production, in terms of damaged tissue, when we have damaged tissue, that ATP production drops down. Now, we're not looking to create supercells or go way beyond, you know, kind of what the body would normally function at. We're looking to bring that ATP production back up to its normal functioning to, again, help enhance that environment, particularly, you know, with anything that's involving any of the metabolic processes. By increasing that ATP production back up to normal function, then we're going to increase that, you know, again, that metabolic process that's happening on the cell. So that's our ATP. With our nitric oxide, we get nitric oxide that's kicked off into the bloodstream. And again, we'll explore that in a bit more detail in a future video in terms of really what's happening there. But nitric oxide is a key vasodilator. So when we have areas of, you know, poor perfusion, whether that's a wound or a joint space that maybe is arthritic or has dysplasia, something like that, then we're able to increase that vasodilation, which gives all those nice nutrients, that oxygen delivery a little bit more efficiently. It helps to reduce toxins and waste products and get rid of those, and we get this kind of angiogenesis. So again, when we're rebuilding tissues, we get those blood vessels kind of rebuilt in that area as well. It also helps to increase vascular permeability, which will facilitate our leukocyte and our macrophage activity. So again, when we've got areas of broken down, damaged tissue, bacteria, you know, those macrophages, they're going to come in and they're going to clean up that anyway, but we're just giving it a bit of a boost and saying, come on, you can do this a little bit more efficiently. So I always kind of say it's a bit like giving them a Red Bull. You know, they're going to do the job, but we could just do it a little bit quicker if we were more efficient in what we were doing. The increase in nitric oxide levels will also locally alter nerve stimulation threshold and suppress depolarization. Again, I'm going to do a video that looks specifically around pain and how laser specifically helps with pain, but essentially that's kind of our starting point. We also reduce inflammation by inhibiting inflammatory prostaglandins and increase our lymphatic capillaries. So again, kind of we talk about having an anti-inflammatory effect there. And then we also help to increase fibroblast development. So that's both aggregation and activity. And that's in our collagen, osteocytes, chondrocytes. That's all our different tissues. So one of the common questions I get asked is, does laser have an effect on bone? Yes, it does help increase fibroblast development and the different types of like say fibroblasts. It's not just soft tissues that we're going to have a benefit for there. So all sorts of different areas. And again, I'll probably talk about wound specifically, I think, in another video as well, because there's a bit of a deep dive into that. But what I love my little visual with wound management around kind of it being different types of builders that are coming in, and again we're just giving those builders a Red Bull, saying yes, we know you do the job, but let's just do it a little bit more efficiently. So there's a great deal of information, you know, we can go into a lot more detail around that area, I think, in a future video. So in a nutshell, ATP, reactive oxygen, nitric oxide, and because of that we get decreased inflammation, decrease in pain, and an enhanced wound repair environment or tissue repair environment. Now, because of those three kind of areas, and there are lots of other things that are happening as well, these are kind of just the key components that we focus on. Because of all those, one of the things I really want people to grasp is then what we can clinically use the laser for. Very commonly, people say to me, oh yeah, laser, that's the treatment for arthritis, or that's treatment for wounds. I don't like that way of thinking. To me, a laser is a tool. It's not a specific treatment. And it is a tool to help with pain, inflammation, and tissue repair. And if you think of it that way, it's a lot easier to go, okay, well, I have this condition, it has this symptom, which could be pain, inflammation, tissue repair. And because I have those symptoms, I can then use my laser to help here. Now, I'm not saying we're claiming that laser will help absolutely every condition out there. But again, if we think about, let's think about meloxicam. When we pick up meloxicam, it's because we have pain or inflammation. And that's not just for arthritis. We use it for all sorts of different conditions. It's exactly the same way of thinking with our laser. It's not just a treatment for arthritis or wounds. It is a treatment tool for pain, inflammation, tissue repair, which means just like our meloxicam, we can use it on a huge range of conditions. So if you get nothing else out of this video, that's the one thing I really kind of want people to change their mindsets on when they're thinking about where they can use their laser on. Do I have pain? Do I have inflammation? Do I have tissue damage? If you have one of those three, and we don't obviously cross over for any special considerations, contraindications, which again we'll talk about in another video, then we are good to go. It is worth trying. Obviously there are other variables with some conditions, with how deep they are we using the right laser, which we've kind of learned very heavily in previous videos, what it takes to be effective, particularly at deep tissue level. But if we get all of that right, then absolutely there is no reason why we can't be using it. And you know, we talked about the research in another video, and we talked about idiopathic diarrhea, degenerative myelopathy, cognitive dysfunction. None of those are in the same, none of those conditions are in the same level. You know, they're completely different body parts, completely different, but they have very similarly either pain, either inflammation, tissue damage, or they need that, you know, that blood supply. And that's exactly what our laser does, and that's why we get results with it. So I think we'll see many more conditions coming through in the next few years, but moving forward, pain, inflammation, tissue repair, it's our tool. It's not a treatment for a specific condition. So I hope that was helpful, and we'll probably start deep diving again in the next video. Let's probably look around maybe wounds, because actually that can be a controversial one. So in the next video we'll talk a little bit more about wounds, but anything in the meantime, any questions, then just give me a shout.